Hey guys, and welcome to another live. So today I'm going to be speaking to Dr. Geetika. She's the owner of ISAAC Luxe, which is a skin and wellness center, luxury skin and wellness center. She has a few outlets in Delhi and recently opened in Bombay as well. I think that was 1 year ago or 1.5 years ago. Yeah, so I've been going to her quite often. Oh, hey Kat, how are you? Yes, Kushnaz has also been to ISAAC Luxe to see Dr. Gitika. And I mean, her whole approach is very different. All of the machines and facials that ISAAC Luxe has is again very different, very special and yeah, quite unique, I'd say. I've done a few treatments there. One was the GG Glow facial, which like it hydrated my skin and really nourished my skin. And I was pleasantly surprised because for a month after that, my skin was glowing. So I was really happy with my results. Anyways, I can't wait to introduce you to Dr. Gitika, and she will also answer all of your skin queries. And if you have any questions on skincare, hair care, you can just comment and she will answer them for you. Let's see. Okay, just getting her. Just waiting for Dr. Gitika to join the conversation.
Hi,
Hi.
Maya.
Hi,
Hi.
Dr. Gitika. How are you?
All good. How are you? So good to see you.
I know, so good to see you. I was just introducing you to my audience. And what I didn't mention is that Dr. Gitika won the Best Skin Expert at the Vogue Beauty Awards in 2019.
Yes,
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 I
yes,
remember
yes.
that. Yeah. So, um, part of my job is to try out a lot of different, facials and skin treatments and products, and then report back to my audience and, tell them all about it. And I was also just talking about the GG Glow facial that I remember doing with you, quite a while ago now, and how it was very unique, something I hadn't tried before. And I was especially thrilled with the results because it didn't just last for 2, 3 days. It lasted for, a good month, I feel. So, why don't you give us like a little introduction about ISAAC Labs, and then let's talk about, the treatments and technology and machines that you guys have that are unique to ISAAC Labs.
Sure. So, Maya, I'm Dr. Geetika for all the audience. I'm a cosmetic dermatologist, founder and medical director of ISAAC Luxe. ISAAC Luxe was founded by me almost 8 years back, and the flagship clinic is in Delhi in Vasant Vihar. And then we have a clinic in Friends Colony, Gurgaon, and now we have recently also opened in Mumbai. That's where I met beautiful Maya, and we could offer her some experiential. And talking about GG Glow per se, because that's what we started off, and that's one of my star product treatments.
It's
It's GG Glow.
amazing.
Yeah, it's GG Glow because it gives you the glass glow skin. And I learned this treatment in Korea last year. So in Korea, skincare is of course taken really very seriously, and I was always intrigued to learn more and more as to how and what is it that they do differently from us. And this treatment came as a very wonderful surprise to me because it was super easy and yet it was super wonderful in terms of results. For people
Yes.
who don't have the time or they have just a big function or a wedding coming in and they don't have the time to maybe treat their scars or hide their spots with the help of fractional lasers or peels which have downtime treatment, but they need something to not only give them that glass glow skin but also to give them a face which they can just go out without having to use any concealer or makeup. So for this treatment is made for them so that you can just roll out of the bed every day without having to worry how your face is looking. Are there any pores visible? Is there any pigmentation? So this treatment is an answer for that. It's my most recommended treatment for especially brides to be because they also want to put their best face forward at all times, and it really reduces that need of using concealers and makeup because your face is just glowing all the time.
Flawless, natural.
Yes. So what it involves is infusion of vitamins. These vitamins are from Korea. They are peptides. They are different vitamins that we pick and choose depending on your skin type, whether it's dry, whether it's acne prone, whether it's anti-aging. So we use the vitamin infusion with the help of a pen which has micro needles on the top. We form microchannels on the face. We infuse the vitamins, and then we infuse pigments which are natural. So these pigments are derived from iron and silica, so they're perfectly organic and natural. And that is what gives you that perfect glass glow skin. So we are treating your skin from the inside and also giving you that perfect glowy skin on the outside. Generally, this treatment, Maya, we suggest once in a month. But if someone has a wedding coming up and they have a lot of issues on their skin and we don't have time, then I would also call them maybe once in 10 days because then I can build it up even more. So that's what we suggest with this.
Okay, Dr. Geetika, I have like three, four more questions. So once we're done with that, we can look at answering everyone else's questions because they're sending many, many
Absolutely.
questions.
I can
Um,
see a lot of people asking about GG Glow already. It is
yes,
a very interesting treatment.
yeah. And
Yeah.
yeah, and I think, so many brides also look for something to do before their big day. And I think this is just amazing because, like you said, you don't have to, worry about heavy foundation and concealer. After that, your skin is just glowing and it's looking its best and it's good to go. So,
Yeah.
anyway, my next question is about skincare in your 20s versus skincare in your 30s. What are you
Hmm.
supposed to be doing differently? Um,
Hmm.
and this is the age bracket of my viewers as well, 20s to
Hmm.
30s. So,
Hmm.
what can you tell us about that?
Sure. Maya, so many times I tell them, my patients, that your skin at 40 is how you took care of your skin when you were in 20s. So your skin care actually religiously and seriously starts when you're 20, because that's the time you are moving out, your skin cycle is getting disrupted, hormones, acne, pollution, everything is hitting on the face together with makeup. So we have to be very,
Exactly.
very careful in 20s. So we start with your cleanser, toner, and I might add a mild vitamin C serum or a Azelaic serum depending on the skin type, and a sunblock, which is a must if you're in 20s. Because, before that, we might take our skin for a ride and
For
think, you're
granted.
growing.
Yeah.
Yeah, but in 20s, the sunblock has to be used. Sunblock half an hour before stepping out in the sun, and every 2 to 3 hours when you are out in the sun. Because, if you start with the SPF 40, and you're out in the sunblock SPF gets degraded. So it might just become a SPF 15 after 2 to 3 hours. So you have to reapply the sunblock every 2 to 3 hours. It's not like you applied it in the morning and you forget about it. You
Right.
have to reapply. So that's for people in 20s. Now I will talk about early 20s and then late 20s. In late 20s, you should start adding an under eye cream. That's a very good addition that you can do, because more and more you start taking care of your skin early on, more and more preventive things you can do for your skin. So
Right.
start using a good under eye cream, maybe just at night to start with. It's a good idea. Use it from inside to out. Don't scratch or rub your under eye area,
Light.
because that, yeah, so light tapping motion, that's what we need to do. So that's late 20s. And when you're in 30s, I would start adding maybe a retinol or a AHA or a BHA to your skincare regime, depending again on your skin type. If it's oily and you have a lot of pores, then I might just add a salicylic acid based BHA face wash, or some salicylic acid based skin cleaning pads or something like that. And if you have a normal skin with some pigmentation spots here and there, then I would add a AHA gel or a lotion, because that will not only help in treating, but it will also start exfoliating your skin a little bit. So
Right.
that's something for early 30s. And late 30s, yes, you have to be very particular about your anti-aging routine, because it is setting in now and it is more so obvious. So you have to use an anti-aging cream with peptides. You have to use your retinols. You have to use an under eye cream both morning and at night, including the sunblock. So sunblock always stays.
Yes. Sunblock goes without saying. A lot of people, while you were talking about, the under eye cream and things, have said, what under eye cream do you suggest?
Hmm. Okay, so there are a lot of under eye creams, Maya. In fact, if one is wanting to, put their skincare regime to the next level, they can use an under eye cream for the morning and they can use a separate under eye cream for night.
Right.
But let me just make it very simple for the viewers over here. Some under eye creams which are very easily available are Sesderma Reticis under eye cream. Then there is Rock under eye cream. And then there is also Filorga Optim Under Eye Cream, which are very easily available at any chemist shop.
Okay. Okay. Good to know that. And so, which leads me to my next question, which is, what are the best ways to control or take care of those early signs of aging? You know, when you start getting like little fine lines that you've never seen before. What is the best way to look after your skin at that point then?
So sometimes, Maya, we need to identify, is it early signs of aging or is it just dry skin? So if you see maybe an apple which is shriveling or dry, you see the lines more so on that. So sometimes it's just the dry, dehydrated skin which shows the lines more. So you have to make sure that your skin is moisturized and it is supple enough so that the early signs of aging or those wrinkles are not that visible. So that is
Right.
one thing you need to be taking care of. But if you are aging and you have those lines like your wrinkly skin or the crow's feet or dynamic lines, then you have to start looking back that what is it that is causing? Is it genetically you're prone to more aging or there is something in your environment that is causing more aging? Maybe the sun damage, maybe pollution, maybe smoke. So try and reduce all of that. And after all, following the skincare regime, there are other treatments that you might have to go for because you can just do so much with preventing this aging with the skincare products, but you have to treat them once the aging has appeared on the face. So there are two types of lines. There are these dynamic lines which come with the frown on your forehead, the forehead lines, the crow's feet. Then there is fat loss, which happens under the eye, on your cheeks, hollowness of the cheeks. So these kind of agings have to be reported or addressed with a dermatologist who might suggest you some injectables, or they might even suggest you some radio frequency or ultrasound based treatment to tighten the collagen. So anything of these things can be suggested depending on what you're looking at and how aging is showing on your face.
Okay. And my last question is a good routine, a good and simple routine to follow AM and PM for someone who's just looking to do the bare minimum but to care for their skin at the same time.
So if you have to look at just bare minimum, Maya, then I would also talk about summer skincare because now the weather has changed. Use a very mild face wash, maybe a gel face wash, followed by, if possible, a vitamin C serum or a vitamin C enriched moisturizer because that's a powerful antioxidant that we need to fight the early signs of aging and prevent photo damage. And third would be your sunblock. So if bare minimum you want to do with just
Right.
the three products, then this is my go-to thing. And at night can be more replenishing and rejuvenating. Wash your face and apply a good vitamin serum so that your skin can refresh and repair, followed by an anti-aging or a good cream which is more moisturizing, more repairing, because at night your skin actually repairs. So at
Right.
night you can go just a step up.
Okay, great. Okay, let's go through some of the questions. I know I just saw a lot of people asking about under eyes, a solution for dark circles, a solution for fine lines under your eyes. So,
Okay. Maya, with the lockdown, actually, we have abusing our eyes a lot with, be it the digital media, be it Netflixing, not sleeping enough. That is one major thing that I'm also seeing in my patients who are coming to me with a lot of under eye issues. So when we talk about under eye issue, there are three different things. One is just the pigmentation that appears, like on your eyelid above and low. Then there are also sunken eyes, which is the fat loss, which can also be genetic. Then third is the puffy eyes, those bags under the eyes.
wake
And
up
then
with that
fourth,
puffy also.
and then the fourth issue is the crow's feet, which happens with the lines around here when you smile, you see those lines.
Right.
So these are different things which have to be addressed differently. But some general rules of thumb that you should be doing in case you want to take care of your eyes is don't compromise on your sleep. Become a little selfish for your sleep and get at least 7 to 8 hours of sleep every day.